Hi, all those who have cats and their cats are having the problem of gastrointestinal parasite, example roundworms, tapeworms. So, in this video, we would discuss in details about tapeworms, roundworms, and other. The large roundworm known as ascaris are common in cat, especially in kittens. The most important species in cat is Toxocara cati, as it is both very common and will infect people. Toxoscaris linear also infect cat, but it is typically much less common and does not affect people. Infection with Toxocara cati are most likely to be acquired by ingestion of eggs passed in the feces of infected animal and by eating prey such as mice that carry the parasite. Some parasite can be passed to kitten through the mother milk. Adult parasite can then be found in the small intestine of kitten as early as 3 to 4 weeks of age. In kittens that have been eaten infected have had larvae penetrate the intestine, evolve, travel to the lung via the bloodstream, are covered, are swallowed, and mature to the eggs. Infections are not assisted with any sign. The first indication of infection in young animal can be lack of growth and loss of condition. Infected cats can have a dull coat and therefore not pot bleeds. In this infection in which cats have round one, their their skins are damaged and they have a dull coats, bones and round circle shaped patches appear on the cat body. Worms may be vomited or passed in the feces. In the least stage of migrated larvae occasionally cause pneumonia, which can be associated with coughing. Diarrhea with mucus may be evident. Infection is diagnosed by microscopic detection of eggs in the feces. Several drugs are effective for the treatment of round 1 infection in cats. Certain preventive programs for heartworm infection also control intestinal round 1 infection. Early treatment for kittens should be started at 3 to 4 weeks of age, repeated at 2 week interval until 3 months of age, and then continued monthly until 6 months of age. Your veterinarian will prescribe the most appropriate medication for your cat. So hookworm, then the tapeworms. Adult tapeworms are segmented worms found in the intestine. They are really cause serious disease. The common tapeworm of cats Dipledan is acquired from eating fleas. Much less frequently, cats with access to infected house or outdoor mice and rats can acquire the other types of tapeworm infection from these sources, flukes and other. So, disorder of esophagus in cats. Inflammation of the esophagitis is usually caused by certain drugs such as doxycycline, foreign object, or acid reflux. Other causes include eating an irritating or caustic substance, cancer, and calcivirus infection. Acid reflux can be associated with anesthesia, certain drug, vomiting, and feeding tubes. Signs of esophagitis include regurgitation, drooling difficulty or repeated swallowing pain, depression, loss of appetite, and extension of the head and neck. Esophageal Esophageal dysmotility is an abnormal movement of the esophagus. Cats can be born with esophageal dysmotility or it can develop because of certain neurological disorder, tumor in the chest or narrowing of the esophagus. Sometimes the causes are known. Many cats can improve with the use of medication. Foreign object in the esophagus also damage the esophagus, and in the cancerous case, there are also the chances that esophagus may be damaged. Cats are generally pickier eater than dogs, but occasionally they will get foreign object lodged in the esophagus. Bones are the most common, but other objects such as needle, string, threads, fish hook, and wood may also be construct. Signs include excessive drooling, gaping, regurgitation, and repeated attempt to swallow if the object is stuck for a long time. Decreased appetite, weight loss, and lethargy may be seen. The object can also perform the esophagus and cause serious complication. Many of foreign objects can be seen on X-ray. If a foreign object is found in the esophagus, a veterinarian will need to remove it as soon as possible, as we done in the case if we brought this. Most of the time, the object can be removed with an endoscope, which is a small video camera with a flexible tube that can be placed into the esophagus. Surgery necessary, the esophagus has performed perforated or the foreign object cannot be removed using endoscopy. In these cases, most patients recover, but there is an increased risk for poor healing or narrowing of the esophagus. I hope you would like the video and like, share, and subscribe the channel.